So could you please first state your name and career?
Tina Ho, facial plastic surgeon.
So what does an average day look like for you as a doctor?
So it depends. I think week to week, I'm operating about 2 days a week, and then the other days I'm in clinic seeing patients. Clinic hours are usually 8 or 9 to 5 of actually having open office hours to see patients. The patients can include surgical and non-surgical consults, follow-up patients, including those who have had surgery, so post-operative follow-ups, pre-operative appointments, those patients who are getting ready for surgery, and then especially related to the non-surgical side, patients who undergo procedures. They could be your Botox and filler injections. They can also be in-office procedures or surgeries like removing a mole, doing a scar revision, doing in-off surgery, more like eyelid surgery or chin liposuction. And then on the days that I operate, they usually start at 7:30 in the morning. So I'm there a little bit earlier to, get the patient prepared. It just depends. If I have one long surgery, it could be, 5 or 6 hours or so, or I could have a couple of surgeries. But usually if it's a longer operating day, it could be from 7:30 to 3 or 4. If it's more like a half day of operating, I could then be back in the office seeing patients. Other than that, since I'm in private practice, I don't see patients in the hospital or take call other than outside within my practice, before or after my days at the office or OR, and on the weekends too. I don't see patients unless any emergencies under my practice.
So what do you love most about your job?
As a facial plastic surgeon, I love being able to deliver immediate, decisive results for my patients that, help patients not only look good, but feel good. To be able to help a patient, feel better about themselves, have more confidence, where you can really, it's palpable in the room after their cosmetic procedure, really goes a long way to, that sense of gratification there with my patients, and to be able to connect with them, especially since they're trusting their face in me.
So when did you decide to become a doctor?
I had my own childhood surgeries. That largely influenced me to want to become a facial plastic surgeon. I was born with a large nevus localized to my forehead here, and it needed to be removed because it could have been potentially cancerous later. I had about 10 reconstructive surgeries between birth and 4th grade. A lot of them were at CHOP, Children's Hospital of Philadelphia, and I saw there through those experiences the positive, decisive, and immediate impact that my own surgeon had on me. And I'm just walking here. I just need to actually charge my computer, but you can keep going with the questions.
Okay, sure. So because you've always kind of wanted to be a doctor because of your own experiences with surgeries, did it affect what kind of classes and extracurriculars you did in high school?
So in high school, I was aware of certain extracurriculars that would help me for my, pre-med application applying to medical school. For instance, I did volunteering in the ER triage at a local hospital. And ultimately, it was not until college where I got involved in research opportunities. But with my interest in plastic surgery and surgery in general, I sought out opportunities to shadow surgeons. I wanted to make sure, was it interesting enough to me to be in an operating room, to watch surgery, watch people being cut on, see blood. And I also had an opportunity to intern with a local plastic surgeon, work the front desk. So that gave me a lot of immediate exposure to the world of plastic surgery.
So what did you major in college?
My first major was neuroscience. It has a nice combination of biology and psychology. And two, it did incorporate the pre-med track to the courses that that you need to take for the pre-med route. I did have extra room in my curriculum, especially since I came in with a good amount of AP credits. So I did take on a second major of international relations. This major came about after going on a couple of medical mission trips, which really, spurred for me an idealism of service with medicine. They are more primary care focused in Central America over 2 spring break weeks. And then also having interest in global health. So this is kind of to the side of having that interest in plastic surgery, but with international relations, I, want to take this opportunity, since you only go through college once, to pick a non-science major. I then ended up interning with Operation Smile in Vietnam for a couple of summers too, going along with the interest in plastic surgery and with global health.
Mm-hmm. So I know like medical school is so competitive these days, and like as more and more high schoolers are thinking about doing like pre-med in college, what would you say to like high schoolers who are looking to do pre-med in college to like be competitive for medical school in regards to their extracurriculars?
So I think regardless for any applicant, you want to make sure medicine is a career for you. I know it's, tough. A lot of it is going to be just going through the pre-med classes and seeing how well you do. They're called weed out classes for a reason. But you want to make sure regardless, because if you like another profession just as much as medicine, whether it's like law or business, or teaching, strongly consider that, because medicine is such a narrow path. There's so much time, effort, finances, personal life, sacrifices involved. It's always going to be there because it takes so many years to do it. So, you want to make sure in a mature sense that this is the career path for you. It's very isolating. And later on, it will always require you to put it as a highest priority, even above your family, which is tough to always keep in perspective regarding that. Otherwise, you want to make sure too that you have enough of the focus and organization, whether, you make sure you're taking the classes that you need to, and in the right order, and that you have a good study focus with them, because you only go, yes, you could try to retake the pre-med classes later, but you only ideally want to go through them once, right? And these are the most important steps, because you're going to be among a big pond of people who are also pre-med. You have to do the best among this pond of people in order to stay competitive. So you have to get A's, for the most part in these classes. And if you don't, then that just is an indication to you, whether medicine is for you. Fortunately, unfortunately, whether it's getting into a certain college or getting into medicine, you have to have certain scores and certain grades. And it only gets tougher. For me, the MCAT was a wake-up call of how tough that exam was, and I didn't do as well as I would like. And I realized in med school, I was very average. I no longer got A's. I was very average in my med class. And you're always being tested. You're always having to take exams and having to pass. And my expectations and goals, quickly transition from getting A's or being the top of the class to being able to do the best I can for myself as an average person among my peers.
Mm-hmm. So what did the pre-med track look like for you in college? Did you have a pre-med advisor?
So for me, as I mentioned before, I was lucky to have a lot of AP credit. So I tested out of the intro to biology and general chemistry, and that had me take organic chemistry, and I was able to take physics my sophomore year. And afterwards, I actually was able to take MCAT for the first time my summer after sophomore year. So a little bit ahead of the other, students on average. And then for pre-med advising, yes, we had one formal pre-med advisor that I would occasionally come to kind of check in about my path and progress. You want to make sure it's someone that knows you and helps you along the way and is very knowledgeable. I maybe could have seen her more but at the time I was very confident about the process before I took the MCAT. I also relied on my own advisor through my department, like for my major, because they also too counsel a lot of students who are pre-med and have that awareness from the science side, particularly.
Mhm. So, how was medical school? In other words, what did it feel like in terms of rigor studying, and did you like it?
For medical school, so yes, it's a totally different level of rigor. Undergrad, I was used to being able to do a lot of extracurriculars on the side, and you really have control over your schedule. It's the first time you have that coming out of high school. And so I invested a lot more time in extracurriculars versus actually studying. Medical school, this is where, and you're literally paying, to go to school and to become a professional. So you have to figure out, like, you're always studying a lot, especially I went to University of Virginia, which has a large undergraduate campus. It was tough to be able to be walking in to the library Saturday nights going to study, where you saw the students going out to socialize off campus. But you have to have a study schedule, be very focused, and because this is what you are investing your future in, to do medicine. I did enjoy it, I think, the sense of, because this is what I ultimately want to do, right? It's the next step in my career. So all of the most classes were, interesting, or somewhat interesting for the most part, and what we were studying day to day, versus undergrad, like high school. There are certain courses you have to take that might not interest you as much. I was around a great environment, peers, where our first 2 years were not pass fail. So it didn't feel as cutthroat. We were all balanced individuals, kind of worked hard, play hard. I felt lucky to take the opportunity to do things, to pursue, other things outside of school too, to stay balanced, like whether it's exercising, meeting with my friends and cooking dinners once a week. I was part of student government. So I think that helped me stay balanced and stay fulfilled in medical school, and enjoy it too. So I overall had a, good impression of medical school. I don't think of it as super stressful. I think with just the structure of my medical school and the balanced students that it trained, because definitely residency is where it's the most stressful and challenging aspect of the medical training.
Mhm. So, how did you pick the field that you wanted to go to? So, in other words, why did you pick plastic surgery over the other fields?
Mhm. So I didn't know, I ended up going to facial plastic surgery and not general plastic surgery. I didn't know much about ENT, ear, nose, and throat, until I was actually in medical school. And medical school is where you figure out what you really want to do, and especially after you rotate through your rotations, third year. My favorite core rotation was general surgery, and then I did electives in general plastic surgery and ENT. ENT, I felt like it clicked more with me, just because I could be a head and neck specialist, focus mostly on the face, really enjoy the intricate anatomy instead of being an expert of the entire body. I think I clicked best with the attendings and residents there in terms of personalities, their sense of work-life balance. I saw a route to facial plastic surgery still, which was enticing. And it's a good balance of like operating and seeing patients in the clinic, but not feeling like you're spending all your waking hours in the hospital or in the OR. A lot of the patients can still be healthy. The surgeries may not be significantly long on average. And so, a lot of these things were appealing for me to pursue, applying to residency in, ENT, head and neck surgery. During residency, I try to be as open-minded as possible, but, facial plastic surgery was my calling still. I feel like I enjoy, doing the superficial procedures to the face, both reconstructive and cosmetic. A millimeter change can make a big difference. I'm very meticulous, detail oriented, which I think goes well with being a plastic surgeon. I also tend to be impatient too, wanting that immediate gratification, seeing immediate results. I think that, just naturally, occurs with having a personality of a plastic surgeon or a surgeon in general. I also don't mind too. A lot of my patients are healthier. They go home the same day after surgery. So from a work-life balance standpoint, as I mentioned earlier, most of my work is confined to the hours I spend at the office or operating.
Mhm. So what did residency look like for you and how long was it?
My residency, I went to University of Kansas and did ear, nose, and throat residency for 5 years, and then a 1-year fellowship training in facial plastic and reconstructive surgery in Chicago. So 6 years total. My residency is a strong program clinically. It gave me a good exposure in a lot of different environments, which I was hoping for to help me figure out best the type of surgeon I wanted to be. So not only was I in trained in an academic center, I trained at a VA hospital, private hospital, the county hospital, a standalone pediatric hospital, which I felt was really valuable instead of just training just one hospital total, because that can, the experiences in residency, you do certain core, you see certain core or common conditions and procedures, but the experience itself can vary a lot between residency programs. I overall, would say I am very grateful for my training experience overall. I have really strong mentors and friendships from it still. It's that I am actually surprised. I thought leaving that environment immediately that I would really miss it a lot, just because that sense of community and the intensity of and rigor of that training in such, 5 years is a long period of time. You don't have that anymore, especially if you don't stay in academics, because I'm by myself now, for the most part. I don't see and collaborate with other doctors on a regular basis. I don't miss it as much as I thought I would, but it is that, that kind of experience you're never going to have again, with your training. At the same time, it was the most challenging period in my life professionally. I would say I struggled more as a junior resident. They say it's like a fire hydrant where all this knowledge, is thrown at you. You're trying to absorb. You're then trying to, learn to take care of patients and take call, being sleep deprived. You're responding to certain chains of authority in terms of taking care of patients and learning to manage patients, but also learning to operate at the same time. So it's a lot, going at you. And, but I did still overall have a very positive experience, and I, don't regret, training at the programs that I did.
Mhm. So one last question, do you have any advice for aspiring doctors or pre-meds?
So my couple of bits of advice, I think for me, if you're talk to me and hear more about my story, I'm a good testament that if you have, a good foundation of work ethic plus the passion, drive, anything is possible, so don't give up, especially if it takes you, more than one time to apply to medical school. Yes, there are certain, uh, certain numbers or certain things you need to meet to be able to make it in medicine. And that's inherent nature, the name of the game, whether you have good enough test scores and grades, because you have to meet, whether it's from an aptitude or intellect level, to be able to take on the amount of knowledge, and rigor that you face in your training in medical school and residency. I otherwise, a couple other pieces of advice, make sure to vouch medicine as much as you can, that this is the specialty for you. Or even a surgical subspecialty. So make sure if you enjoy something outside of medicine professionally, it's just as much as medicine, or some other specialty just as much as surgery, strongly consider that, because there's a certain level of dedication, sacrifice that's needed. You end up sacrificing a lot more than your family and peers career-wise when it comes to pursuing medicine. And, the route in medicine is a long one and can be a lonely one. So make sure you stay balanced and prioritize self-care, prioritize those things you enjoy outside of medicine as much as you can. If you need to take a gap year, after college or applying to residency, do it too. I went straight through my training after I finished my fellowship. I took 5 weeks to go travel in Europe with my now husband. And then we got married in October and went on a honeymoon. I didn't start my first job until November. And I don't regret it. I wish I took even more time off, because once you get started in the process, or when you start working, it's really hard to take the time off later. I'm an OCD planner, so I have to conscientiously put things on the schedule, even if we're taking a long weekend off here and there, to make sure to prioritize my family and my sense of balance and self-care. At the end of the day, physicians, especially now during the pandemic, we're prone to burnout. So, you want to be the most balanced, rested, well-rounded individual you can be, because that will help make you not only feel better as a person, but a better physician overall, and take better care of your patients.
Mhm. Okay, thank you so much for letting me interview you today, and I hope you have a great rest of your day.
You too. Thanks so much for your time and the opportunity. Appreciate it. Take
Bye.
care. Bye.
You too.